So, hi everyone. Thanks for joining us today. My name's Kate. I'm the Communications and Campaigns Officer at the Survivors Trust. So, for anyone who hasn't heard of the Survivors Trust before, we're a national membership organisation for specialist rape and sexual abuse services. So, we currently have over 120 member organisations across the UK, and our members provide vital support services to people of all genders and ages who have been affected by sexual violence or abuse at any time in their lives. So today we're really excited to be joined by Simone and Sophie from the UK's leading sexual health and wellbeing charity Brook. And this is for a special Q&A to mark Sexual Health Week. So Sophie, Simone, if you just want to give a bit of a background into the work you do at Brook, that'd be great.
Yes, of course. Thank you, Kate. So we, as you've said, we are a young people service. We also have all age services as well, some clinical services throughout England. We provide sexual health information and advice, contraception within our clinical services, both for young people and for adults. Also, we deliver education sessions in a variety of places, so in schools, in colleges, in community spaces, and also we deliver professional training sessions, counselling services for young people, and advocate for young people's rights also as well, right across the UK, including Wales also.
Amazing. Thank you, Simone. And then also joining us today as well is my colleague Lucy, who coordinates the Survivors Trust Trauma-Informed Healthcare project, Check With Me First. So Lucy, I don't know if you just want to give a bit of a brief insight into that project and the work you've been doing with it.
Yeah, hi, thanks, Kate. So we're running a project called Check With Me First, which is a campaign that we're running across NHS nationwide. And the idea is just to educate practitioners and patients about trauma-informed healthcare, because we know from so many of our service users that people who have experienced any trauma, particularly sexual abuse or sexual violence of any kind, means they're anything up to 82% less likely to attend their healthcare appointments because they can find it so triggering. So we just want to open up that conversation really for everybody involved, and particularly for young people, because it's just so important for them to attend such crucial appointments that can really prevent really serious lifelong illnesses and improve their quality of life.
Cheers. Thanks, Lucy. And I suppose kind of the Check With Me First campaign really is how this sort of collaboration has come about. So sort of over the last few months, the Survivors Trust and Brook have been working together to produce healthcare resources for survivors of sexual violence and abuse and for healthcare professionals. So these resources will have launched this week. And they offer sort of information for anyone accessing sexual health services and sort of tips about attending these appointments, and also tips for healthcare professionals as well about how best to support survivors attending these appointments. So we really just wanted to take today as a chance to just have a chat about trauma-informed healthcare and why it is so important in helping survivors feel more comfortable and confident to access sexual health services. So really, I'm going to be popping some of our frequently asked questions to the team today, and we'll just kind of take it from there. So I suppose sort of first up for Sexual Health Week this year, I know at Brook you're focusing on the theme of breaking barriers. So it'd be really great if you could just share a little bit about this focus for this year, and some of the challenges that young people face when accessing services as well.
Absolutely, and I think as you said there, Kate, yep, Sexual Health Week this week, the focus is breaking barriers. One of the things that we wanted to highlight is that everyone should be able to access sexual health and wellbeing services in a way that best suits them. And as Lucy said, you know, the reality is that too many people, you know, maybe face barriers in being able to access those services. we want inclusive and non-judgmental support within those services. And I think quite a lot of people may find it quite challenging to access healthcare appointments without thinking, around survivors especially. They can be quite uncomfortable, they can be stressful. However, it absolutely can be more worrying for survivors. It can re-traumatize, it can be triggering, and with the nature of some of the sexual health appointments as well, it can be quite intimate, some of those appointments. And I think people might worry about, might I have to tell someone what's happened? What will they be asking me? How will I feel? Will I have to tell my story? So I think, certainly with the breaking barriers, with working, really closely with the Survivors Trust and all the work that's going on next week, hopefully we'll be able to kind of support in some of the messages in accessing some of those services that can be really helpful.
Yeah, no, that's brilliant, Simone. It was really sort of exciting to see the theme launched for this Sexual Health Week. So it is such an important conversation to be having. And as you say, it affects people across sort of so many different areas, not just survivors of sexual violence and abuse as well. So I suppose Lucy, this might be a a good question for you. Can you think of any other potential barriers to sexual health care that survivors of sexual violence or abuse may face specifically?
I think just building on what Simone said, it's so important. The thing that's really hit me in running this campaign is the amount of people that have said to me, "Oh, I hate attending those appointments anyway," and they might not be survivors, or if they are, they certainly haven't disclosed. It's not nice having any sort of internal examination or discussing anything to do with our sexual health. We're just still all a little bit uncomfortable about it. Now, if you are a rape victim, it's going to feel really uncomfortable. We don't know the circumstances that you might have been abused or attacked in, but it's very likely that the perpetrator made out that it was your fault and left you with some sense of guilt or shame. And that can just make it really hard just to get into the door of the health practitioners, let alone the, as Simone was saying, the actual physical intervention. Quite often it means that the patient is temporarily out of control, and the health practitioner holds the power, which of course is very reminiscent of the relationship between the person who was being abused and the then victim. So it's really, really important that we're aware of that and that we reach out to them to break that down. And there's several ways we're trying to encourage people to do that. It's to plan ahead as well. So if you're able to ring ahead and tell the practitioner your experience, or just say you're feeling very anxious, that can really help reassure you and them as well when they get there. That people often say, "Oh, I'm often late to appointments," they get in trouble for it, but actually it's because they were so nervous about coming, they weren't sure whether they were able to attend. So just being a bit mindful of that. But actually, if you ring ahead a couple of days beforehand, you might find that can really reassure you. And then, of course, once you're in the appointment, if you're able to say, just "I'm anxious," and then we're encouraging the practitioners not to ask any more details unless it's not needed. If you've just got that information, then we're just asking these three main points, which is just to check in with the person, check they're comfortable before we touch them or have any physical procedure, explain what's going to happen before it happens and as it's happening all the way through, and just reassure them and make sure that they know that they can stop at any time. And if we put those three things in place, they are three things that almost certainly did not happen during any sexual abuse or attack. And so that's really reassuring for the patient, and that gives them back the control they need to attend their health appointments.
Cheers, thanks, Lucy. Yeah, those are really great points, and it's just some early ideas of things that can make a big difference for a survivor. Because often they can just be small changes for an appointment that can make a really big difference. So as we've just said, we know there are lots of barriers to accessing healthcare for many different reasons, and trauma-informed healthcare is being discussed more and more often as a way of improving healthcare experiences and making services more accessible. But that I think it's one of those words that has the potential to become a bit of a buzzword. So I think it's really important for us just to kind of highlight what exactly we mean when we're talking about trauma-informed healthcare. So yeah, I was going to say, whoever wants to tackle that one, go for it.
I think I've come off mute, so I'll go. I think it's thinking about what's happened to somebody rather than what's wrong with them is certainly something that's really, really important. You know, not thinking too much about the behaviours and being open and transparent, and that kind of professional curiosity about what can we do maybe that could be really helpful. Certainly, you know, thinking about the check with me first, the 3 small actions, you know, that check, that explain, reassure, you know, providing, you know, people to be able to make their own decisions, letting them know about what the procedure may involve if they choose to go ahead, you know, with a procedure within a clinical appointment, and giving people absolutely that choice back, and then us as professionals looking at ways that we can best support and thinking about them rather than the behaviours. And I think that goes the same as well, you know, with thinking about trauma-informed healthcare. I know that's the question you asked, but being mindful as well, our colleagues, you know, kind of checking in with them as well. You know, we might find it difficult, you know, at times as well, and being able to check in with colleagues and having that wider trauma-informed approach. So we're thinking about people that we come into contact with, whether that be young people, adults, service users, and also our colleagues as well. That kind of wider trauma-informed approach, I think is really, really helpful.
I think as well, just to build on that, it's about we quite often in all the jobs we do get desensitized to it, because, you know, and I think if you're I can only imagine if you're working in that area and you see it so many times, but it's easy to forget that actually for any patient it's a big deal. But if you've got 10-15 patients all coming in with the same thing each day, it's easy to forget that each one of them is feeling anxious even if they don't show it as well.
Yeah, definitely. That is a really good point, Lucy. I think sort of, yeah, that kind of, we know healthcare professionals are so pushed for time. So yeah, it's just that, just remembering that sort of every patient or service user that accesses a service may have experienced something traumatizing in their life. So yeah, just having that mindful approach and sort of taking steps to prevent re-traumatization is so important. So sort of in terms of sort of how could a trauma-informed approach help sort of survivors who want to access sexual health services, and kind of what would your sort of tips be for anyone who is particularly anxious? I know Lucy sort of mentioned phoning up ahead. Are there any other kind of like practical things you would suggest that anyone who is particularly anxious about an appointment might consider doing?
Yeah, I can speak a little bit to that, kind of building on what's already been said. So I think we can also speak about the resource as well that has been made. So there's some advice on there on what to do if someone is feeling anxious or feeling a bit nervous before an appointment. So it might be good to kind of sit down and think about what kinds of things are going to make you anxious before, and what can you do to kind of put some steps in place to kind of make you feel better during the time. So we have some examples in the resource, such as, I think Lucy mentioned earlier, calling ahead and just finding out a bit more about what the appointment is going to be, and what's going to happen, so that, yeah, they can kind of they have kind of more control and they can understand what's going on. Perhaps as well, if someone's feeling really nervous, they could take a friend or someone that they really trust along to the appointment with them. I think sometimes it's worth, again, calling first just to check that that's okay. I know during COVID there were some changes around people bringing kind of support friends along to appointments, but I think that's now back in place. So yeah, bringing someone along with you, and then also if you get to the day and it is just feeling like too much, it is okay to rearrange, and just to be really gentle with yourself and not push yourself if you wake up on the day and it just doesn't feel like the kind of right day for it. It's totally fine to rearrange appointments like this.
Brilliant. Thanks, Sophie. Yeah, those are really great points. And I think it is really important to just be really sort of mindful of how you're feeling, and sort of, as you say, don't put too much pressure on yourself. Sometimes it's just taking those little steps, whether it's just phoning up to inquire to begin with, and then going back at a later date and thinking, actually, I will book the appointment. It's just taking it at your own pace, isn't it? Sort of, Lucy, I suppose through kind of the Check With Me First work, are there any other kind of tips that you found survivors have sort of used that have been useful in kind of within the appointment, whether it's sort of things like grounding techniques or any suggestions around that?
Yeah, I think knowing your grounding techniques before you go, you know, some people say just taking stock of the room and being able to name the things in the room can help if you're finding that you are having a panic or a flashback. The other thing that's come up quite a lot is the use of curtains, and quite often, particularly if you're an inpatient, you might need a procedure done and you've only got a curtain separating you from the ward. You can hear other people talking. If that's really uncomfortable, you can just ask to go to a different room, and fairly often they will accommodate that. And in terms of sexual health as well, it's just sort of doing your research beforehand, because you can often get given a lot of information, you're feeling a bit anxious about it, you might not retain it, and it's good to go in armed with information. It can reassure you once you're going in as well, to know what might be said and what you might be facing. So there are some useful tips. And in terms for practitioners as well, just thinking about where the chairs are facing, if they're facing the door, where the bed is, making sure that colleagues aren't just going to walk in, and just respecting as much confidentiality as is possible, I think is the key there.
Yeah, no, that's brilliant. Thank you, Lucy. And I think that's a really good point as well about kind of research beforehand, because I don't know if everyone else is like this, but you go into any appointment, I completely forget any form of questions that I may have had or anything. So I think being able to kind of like write down anything that you want to clarify beforehand, or things that you want to find out, so you've got them on a piece of paper, just because it's so easy in that situation just to go a bit blank.
And I mean, I hope there's no more lockdowns, touch wood, ever. But you know, if there was, it was a real issue for people there. And you know, even having a friend or a partner or family member on speakerphone, if the practitioner would allow you, that's another way to have someone there for a bit of support and to listen in. Or even ask if you can just record it on your phone, because I think you're completely right, Kate. I think for any healthcare appointment, it's our health. We kind of panic and we might block it out a bit. So yeah, it's really good to make sure you document it.
Thanks, Lucy. And Sophie, did you want to add something?
Yeah, I was just thinking about kind of during the appointment, and another tip that just popped into my head. But I think I know for some sexual health appointments, depending on what it is that you're going there for example, an STI test where there might be swabs or something, there might be the option to ask if there are parts of the like test that you can do yourself. So, for example, sometimes you might you could ask them, like, if you could do one of the swabs yourself, so that you're kind of more in control of it as well. So yeah, perhaps asking when you get there if there are any parts of the test that you can do yourself is one way perhaps of feeling more kind of in control of it as well.
Thanks, Sophie. Yeah, that is a really good point. I think it's something that not many people would realise is even an option sometimes, but as you say, often if you would just ask, there are opportunities to sort of have that little bit more control. Simone?
And Sophie just reminded me there as well, everybody's entitled, you can have a chaperone, you know, if somebody's feeling uncomfortable, absolutely, you know, you can have someone chaperone there and support that way. And also something else that kind of popped into my head as well, sometimes sexual health clinics might be in a larger hospital and they're quite tricky to find. So again, allowing that little bit of extra time if anyone can. Just, I know when I go into a hospital and I'm looking for a department, it can be overwhelming to say the least. So, you know, that is something just to kind of another thought there, just to think, you know, where is it? Am I going to be able to find it in time? And if you're late, that's absolutely fine. That's okay to be late as well. So not to let that worry people too much also.
Yeah, no, thanks, Simone. That's a great point. Yeah, trying to navigate hospitals can be a nightmare at the best of times, but if you're already feeling a bit anxious, it can make it that much more difficult as well, can't it? I think another point as well, I know sort of as part of the Check Be First campaign, we've got some templates on our website, so I can include a link to these at the bottom, and they sort of give survivors a few different options. There's a plain template that just kind of outlines that I may find an appointment a little bit more difficult, and you can add sort of a few notes as to things that a healthcare professional can do that may make the appointment easier for you. So there's a plain version, then there's one with the Survivors Trust logo as well. So those are things that people can print off and take to an appointment with them, just to kind of highlight that they may be feeling that little bit more anxious, and just might need that little extra time. And I think as well, just remembering that it's okay to kind of stop in an appointment as well. Sort of agreeing a signal sort of beforehand, because we know sometimes that if you're feeling particularly anxious, you may not be able to sort of say out loud sort of that you want the procedure to stop, but just a hand signal or something that you can agree with the healthcare practitioner can be really useful. Just so you know, sort of just because you've kind of gone into the appointment and something started, if you're feeling overwhelmed, you can stop. So yeah, but as Sophie says, the resource which we've put together with Brooke is out, and the link will be in the video description, and there's loads of tips in there with different things you can do before, during, and after appointments as well. So it'd just be great to hear kind of some of the things that you think are barriers to healthcare professionals in providing trauma-informed care, and then sort of some tips that you'd have for any healthcare professionals who want to practice in a more trauma-informed way.
I think, we've come off mute together. Sorry, Lucy. I think I just wanted to kind of pick up a little bit on the time. You know, sometimes as professionals, we think we've got to have those longer interventions when we're thinking about trauma-informed approaches, whether that be in healthcare or out of healthcare settings. And I think when we try and think of what can we do, what could we do better, how can we make our service more helpful for young people and adults, is if we are professional, if we're caring, if we show empathy, if we're having that kind of thinking about what's happened to you rather than what's wrong with you, in a very short space of time, that can be a positive interaction, that can be a really positive experience for survivors, and for people accessing services. So it doesn't always have to be those longer interventions. We can have a real impact. And I know something that we've thought about is maybe when people are accessing services, you know, absolutely we want that inviting and comfortable as well as professional, but maybe like that a tick box where people can tick, you know, if they're feeling uncomfortable about something, could be really helpful as one small kind of maybe change to a service. Could be something that could be really helpful when we think about what could we do differently, what could be more helpful.
Brilliant, thanks, Simone. I was going to say, Lucy.
Yeah, so I was going to say exactly that's what I was going to talk about, the time, and then you've actually reminded me of something else as well. I think a lot of people have been, when we've been talking to health practitioners from all departments across the country, and actually this consistent thing, whether they're working in sexual health or maternity or oncology, actually everyone gets really nervous when they hear trauma-informed or safeguarding, because everyone wants to make sure they are doing that to the best they possibly can. I mean, you wouldn't be in a caring profession if you weren't, but I think we've got a bit of a stigma around it, that it's some really scary thing and you've got to be really informed and you've got to really know, and you've got to know what to do if there's a disclosure. And we're not saying that at all. And actually that's really putting people off learning more about it. And it is, and that's why we've come up with those 3 very key quick points. And obviously it's a different thing if we're talking about disclosures, but right now that's not what we're talking about. We're talking about giving someone as much empathy in the short time you have with them, to reassure them, to check in with them, and just explain what's happening. And those 3 simple things is the best way to be trauma informed in our practice. So it's a lot simpler than it sounds, and we totally appreciate that it's become very scary, particularly with lots of high profile media cases, but it doesn't need to be. So yeah, that's what we hope this campaign can start breaking down.
Yeah, thanks, Lucy. That's a really good point as well. I know kind of, in some of the Check With Me First discussions, as you say, I think a lot of people worry that being trauma informed in a healthcare appointment involves kind of almost like taking on a counselling role. And that's obviously not what it entails. It is that simple, just checking in with patients sort of frequently throughout an appointment. So it can just be small changes, and they can have a really big impact on a service user's experience. So it's just always important to remember that.
Can I just do a quick reassurance?
Yeah, go for it.
To reassure professionals, a lot of people are probably already doing this and probably already working in a trauma-informed way, but it's just, like Lucy said, because the word has it feels quite scary for professionals sometimes. It's harder for people to recognise that, but I can reassure you that you probably are working in a trauma-informed way, at the moment as well.
Yeah, definitely. I think that, as you say, it's a good point, and sometimes it's just that remembering to use it with sort of everyone you see, because obviously not everyone who's been affected by trauma will sort of explain that they're feeling anxious or particularly nervous or anything. So I think that's it, isn't it? And I suppose as well, kind of, I think Simone, you kind of touched on a great point with the potential tick box. But I suppose we've seen in the last couple of years, trauma-informed healthcare is being discussed more and more often. But are there any kind of like big policy changes or changes to practice that you guys would like to see?
I think without any exact ideas, and just coming back to the touching on where when people are accessing services, they can stop at any time. I think as professionals, just talking through that kind of explaining what's happening and that reassurance, asking someone, explaining what's going to happen and asking them, how would you signal if you felt uncomfortable, if you'd like me to stop, and kind of giving, people some of that choice back, where then they can quite openly, if they're feeling a bit embarrassed about, oh gosh, how would I tell you, I want you to stop if I wanted to stop. And I think sometimes just thinking, having taking a step back and looking at service area, at the wider service itself, because sometimes we come into a place of work every day, we might deliver a service and it almost becomes, where we are just delivering that same service and we're not taking a step back to think, what could we do differently? Could we make, where people walk into reception a little bit more friendly, a little bit more comfortable? How close is that booking in desk to the waiting room? Are people going to feel that they're being overheard? And kind of thinking, just taking some time to take a step back and assess kind of what goes on in the service I work, and is there anything that I could do differently on a whole. And I think really importantly, not being scared of trauma-informed practice and the words. It isn't something different to safeguarding practices. It kind of fits in, to wider safeguarding policies. And if organisations are kind of thinking at different levels, can be thinking, organisation-wide of that trauma-informed approach. So it is for people who are accessing services. It is for people who are working, within that organisation, and that it's embedded all the way through. It's not something that we talk about, when people are accessing services, that we're thinking without them being scary words, trauma-informed practice, but we're thinking about it all the time. Could I do something differently? Kind of a little bit of reflective practice could be really helpful when we're thinking about, you know, how we're interacting with people on a day-to-day basis.
I just wanted to just completely agree with all those points, Simone, and the amount of people we've spoken to that just said we wish this had been in our training. And I think in terms of healthcare policy changes, that's what I'd like to see. It shouldn't be a add-on once you are practicing, that maybe you could learn more about trauma informed. And it's actually, as you say, people are doing it anyway. We're just changing the language really and making the conversation more open. So that I think if we could just make it a comfortable language and more common from the moment practitioners start their training, I think that would be a real benefit. And then just to repeat what I said earlier as well, just to break down the time it takes, it doesn't take lots of time, it doesn't take lots of scary paperwork or anything. It's just an understanding and just thinking a little bit ahead. That's all.
Yeah, thanks, Lucy. Yeah, I think that's a great point. I know it's something that healthcare professionals always raise, that mandatory training would, for anyone working in healthcare, in trauma-informed care, would be so valuable. Often we've noticed through Check Me First campaign, it's very discipline specific. So kind of we do speak to some maternity practitioners who have had training or do a little bit extra around this topic, but we need something across the board and right through to anyone patient facing. So that can be receptionists, to ensure that trauma-informed approach is starting right from the beginning from a healthcare service user journey. The one that's been raised quite a few times in discussions we've had before as well is just that a mandatory tick box. It's something that seems so simple, and especially with like online booking now, you fill out all this information, and just doesn't need to be anything in depth that is a disclosure. It's just simply, I'm feeling quite anxious about this appointment, would just give a practitioner that heads up of, oh, I just need to step back and maybe really slow things down. So yeah, just something that simple could make a big difference. So yeah, I think you guys the points you've made today have been really great. It's been really, really useful to kind of hear all your perspectives. I don't know, like sort of if you've got any final points, feel free to jump in and throw them out there. But sort of otherwise, I think from our side, we're looking forward to seeing everything else that's going on through Sexual Health Week. Obviously, we'll share all the links for the Brook sort of Breaking Barriers Sexual Health Week resources in the description below, and obviously, as I said, to the resources for healthcare practitioners and for survivors will also be below. So yeah, just want to thank you all for your time really today.
Thank you so much as well. Yeah, it's been really great. And I just want to do a virtual thank you to our wonderful colleague, Sophia. So she basically set up, I think, the work between the two organisations, and she can't be here today, but yeah, I just want to thank her.
And I just think it is really exciting, because you can feel a bit glum sometimes with the way the world is at the moment, but actually when you start having these conversations and you see that so many people are, and it's really, there's it's just so great to be working with you guys, and just to see the work that we can be doing, and even in Check With Me First short lifespan, the positive response we've had, and thank you, we've been needing this, and it's really, really empowering to see just what a positive impact conversations can have. So yeah, it's great to be working with Brooke as well. So
yeah, I think, as you say, sort of, yeah, just even over the last 12 months, just it's so refreshing when we have these any collaborations, just to sort of know there are so many people working on different trauma-informed projects in pockets, and it's just bringing everyone together to collaborate.
Definitely. And just to add, I wasn't involved in the resource, and the practitioners and the survivors, and looking at both resources, certainly, the practitioners resource is super, super helpful. So I would encourage anyone, you know, absolutely to download that resource. I've got my copy here, you know, my hard copy. It's super. I think it's just really, really helpful just to have at the forefront of our minds to remind us. And that time, you know, when maybe we do worry and we do panic, you know, if we're familiar with some resources that can help us, then that can only be really helpful. So yeah, absolutely, really helpful, and it's been great to be involved. So thank you all.
Thank you.
Brilliant. Cheers. Thanks all.